Visiting the reef. The pressure acting on a diver's body increases whilst descending underwater due to the weight of the above air and the surrounding water. Therefore, as the diver descends, the increase in pressure causes the air inside the body's air spaces to compress. At sea level, water weighs about 800 times more than air, so as the diver enters and descends into the water, they are quickly subjected to a significant pressure change. The air spaces in the diver's ears, mask, and lungs become like vacuums as the compressing air creates a negative pressure. Most of you may have been on a plane and have experienced ear pain and the need to pop your ears. This is caused by an imbalance between the air pressure inside and outside your ears, and popping them equalizes the pressure. This graph shows the relationship between depth and pressure, and that is the depth increases, so does the pressure. Because deep diving carries certain risks, the maximum depth for recreational scuba diving according to the World Recreational Scuba Training Council is 40 meters. This is because at certain depths, the diver faces risks concerning the gases in the human body. Because the human body is made predominantly of water, there is not really a danger of being crushed due to the pressure. However, the gases in the body are greatly affected. When breathing from a scuba tank, the air being inhaled is the same pressure as the surrounding water. Although the water is pressing in on you, the air you breathe presses back out the same force, making it easy to breathe. Breathing pressurized air underwater is the same as breathing air above water. When diving, the increased pressure of the water compresses nitrogen in the blood and more of it gets dissolved in the body. The deeper a diver descends, the more nitrogen the diver's body absorbs. However, the problem is getting rid of the nitrogen when resurfacing. During resurfacing, and as the pressure decreases, the nitrogen begins dissolving out of the tissues of the diver's body. This results in the formation of small nitrogen bubbles, which then get carried to the lungs and breathed out through the process of off-gassing. If a diver ascends too quickly and the nitrogen escapes the body tissue too quickly, the small bubbles can combine to become larger bubbles, which can do damage to the body, including things such as decompression sickness or the bends. When the gas in the body is compressed, the solubility of the gas in the liquid such as the blood increases in proportion to the increased pressure. The relationship between gas pressure and solubility is known as Henry's law, which states that, at a constant temperature, the amount of a given gas that dissolves in a given type and volume of liquid is directly proportional to the partial pressure of that gas in equilibrium with that liquid. To explain this law, Henry derived this equation. This can be related to decompression sickness as shown in this video. Buoyancy is what determines whether an object will float or sink when it is put into liquid. Objects that are less dense than the liquid will float, while objects that are denser than the liquid will sink. When scuba divers go underwater, it is ideal for them to become neutrally buoyant, meaning that they are the same density as water, and are neither sinking nor floating. Divers are able to achieve a neutral buoyancy using buoyancy devices such as weight belts or buoyancy compensators. It is very important for a diver to reach neutral buoyancy. If they are not dense enough, they will rise back to the surface, and if they have no control, could be at risk of decompression sickness. If they are too dense, they will sink to the ocean floor. In order to calculate the buoyant force of a person, my own age and gender, assumptions had to be made. This included assuming that the volume of a human 5 cylinders, 2 arms, 2 legs, torso, and a sphere head. As seen in the calculations, the buoyant force is positive, and therefore the body has positive buoyancy and will float in water. It will also float in water because the body is less dense than water, which is demonstrated in the density of body calculation. A temperature such as 25 degrees Celsius may seem comfortable in air. However, this may feel significantly colder in water. This is because water is a much better conductor of heat than air and is a great factor in body heat loss such as during diving. Another reason for greater heat loss when diving is breathing. Breathing accounts for about a quarter of the body's heat loss in the form of exhaled warm air. The deeper we dive, the denser the air we inhale. At a depth of about 10 meters, the air breathed in and exhaled is already twice as dense as on the surface, which means that the heat loss from exhaling is twice as large as well. And because of this, and due to the fact that water draws heat away from the body, divers become at risk to hypothermia. This image shows a rapid decrease in temperature between 100 and 200 meters. It can be seen that the deepest, coldest water is 4 degrees C, the temperature at which water is most dense. Dramatic temperature changes such as this is why divers need to take reasonable precautions when diving. To prevent accelerated heat loss, divers wear exposure suits, diving suits that are either sealed dry suits and do not allow any water in, providing insulating properties, or wetsuits where some water gets in. In wetsuits, a thin layer of water that's been warmed up by your body does the same. However, the increasing pressure gained as a diver descends compresses the insulating gas bubbles inside the exposure suit, making it less effective as the diver goes deeper underwater. Proper training, good equipment and careful execution are the keys to safe diving.